conference is the high-level conference. We expect the highest authority of the country and also the one who are present here from different countries of the 6 regions of the world to commit and present what are those commitments to achieve the goal of the reduction in 50% of the impact in health of the pollution of air.
We have a lot of data. No? Are we really able to use that in a way that is going to motivate action at local level, at national level? And also, are those data saying enough about this disproportionate impact on the populations in situation of vulnerability? No? Because we know that how you're impacted by air pollution is not the same if you're rich, if you're poor, if you live in an area where you still need to use fossil fuels to cook your meal and to heat your house. We also know that there are biological vulnerabilities like children who can be more susceptible or the elderly. So there's a whole world around this. And I think what is really important that if the intention is there, if the different stakeholders are there at different levels of the national, subnational, local, really hyper-local, in the communities, that's where action can happen. Very often it comes driven from the communities, and I think this is also shown here that the civil society action that we see here, together with the scientists, together with the policymakers, that's what makes us powerful.
Yeah, in these 2 first days and now the 3rd day of the conference, was really impressive to hear and see the plans, the national plans that countries are committed to implement. That in the case of China was really wonderful. It's a big country with a very important number of population, and also what they are doing in terms of commitment of the government is really amazing.
I also think that there's a lot of other actors here, like UNEP, like World Bank, like many others that are also driving in the same way. And I think what would be really great to have this global platform where everybody is really, working together, put their nose in the same direction. And of course, WHO has laid out the global guidelines of where we have to go, but have that commitment from everyone and really pushing us in the same direction. But as I said earlier, I think equity really has to be at the center of all our work. If not, we risk, like with any crisis, that the gaps between the ones who are better off and the ones who are already left behind become even bigger because of the health issues and because of the disproportionate exposure. So very, very great to be here.